All right, let's talk about poisoning. So every day you come into contact with poisonous things. If you've washed your hands, done your laundry, cleaned the floors, put on deodorant, all that stuff is potentially poisonous. For all you teenagers out there, please don't eat Tide Pods. Those are poisonous, for example. A lot of things are poisonous. So acute poisonings are something like eating Tide Pods. That affects about 2 million people a year. Chronic poisoning is a lot more common. Chronic poisoning is like somebody who drinks alcohol every day and chronically is poisoning themselves, where every day they're being exposed to that same poison over and over. And that's a lot more common. So deaths caused by poisoning are fairly rare. There used to be a lot more poisoning deaths in children in the early days, like back before the 60s, but then they came out with child-resistant caps. You can't really buy anything now that doesn't have a child-proof cap on it, and so that helps decrease those children poisonings. And then deaths caused by chronic poisonings in adults, though, have been on the rise because of drug abuse. So if you think of like opioid overdoses and things like that, those have been on the rise. Identify the patient and the poison is going to be your biggest job. So that's going to be when you go to the scene of a poisoning, the number one job of the EMT is to recognize a poisoning has occurred. You may not be able to figure out what the poison is, but you want to figure out, hey, a poisoning has occurred so that you can alert the correct authorities. You can call poison control, you can call medical control, and you can get that person the right help. If you don't know that they were poisoned, then you're not sure. You might be thinking they had a stroke or something like that, and there's nothing you can do to help them. So toxicology is the study of toxic or poisonous substances. A poison is any substance that can basically damage the body or impair the body's function. A toxin is a poison that comes from a bacteria, an animal, or a plant. So a toxin is almost like a naturally occurring poison. That's a toxin. Substance abuse is misusing any substance to produce a desired effect. So those of you that drink coffee every morning, that's substance abuse of caffeine. Overdose is a toxic dose of a drug. Your primary responsibility to the patient, again, is to recognize a poisoning has occurred. Look at your surroundings. Use your senses. You want to make sure that you don't get exposed to the same substance. A very small amount of a poison can cause considerable damage or death. If you suspect that there's been exposure to something toxic, call medical control, begin emergency care if it's safe. If it's not safe, call for the hazmat team to get that chemical removed or poison removed. Signs and symptoms of a poisoning will depend on what the person was exposed to. We're not going to sit here and learn all the different symptoms of all the different poisons. You'll never know that in your whole career. Your job is to know that there has been a poisoning and to try to get information about it from the patient or from the bystanders. If you see, injuries at the patient's mouth, they've probably ingested a poison or eaten a poison, damaged the mouth. If you can talk to the patient or bystanders, you want to ask what substance was taken. When did they take it or when were they exposed to it? How much did they have? Did they eat or drink anything before or after they took the substance? How much does the patient weigh? Try to figure out the nature of the poison. Are there clues in the area? Do you see, drug paraphernalia? Do you see Tylenol bottles? Do you see a Tide Pod container? What do you see? Anything that looks suspicious, put it in a plastic bag, take it with you to the hospital. Any kind of like pill containers or paint containers or any kind of chemical like that can give a lot of helpful information to the ER. So bring those with you, or if it's not safe to bring them with you, at least take a picture of the label. Okay, if a patient vomits, look in their vomit to see if you see any pill fragments. They use this as a good time to remind you to make sure you wear gloves if you're going to dig through other people's puke. Anything that you find, you should document that. Scene size up. What are you looking for in the room? Is there an odor in the room? Is the scene safe? Are there medication bottles lying around? Is there, if it's a prescription, when was it prescribed? How many are missing? How many are they supposed to take each day? If they got it prescribed yesterday and the bottle's empty, that's probably not a good sign. Do you see alcoholic beverage containers? Are there syringes or other drug paraphernalia? Is there an odor that might tell you there's a drug lab? Things like that. So what do you do for a patient who has a poisoning? Well, just like any other patient, we start with ABCs. Open the airway, help them breathe. If they're having trouble breathing, give them oxygen. Have suction ready. If people inhale a poison, they commonly vomit, if they are exposed to any poison, they commonly vomit. But if they inhale it, they commonly have pulmonary edema, which can cause that pink frothy sputum that needs to be suctioned. Circulation, you're just going to check their pulse, check their skin condition, just like we would with any other patient. Transport decision, if they have any problems with the ABCs or you have a poor general impression, transport right away. Just remember, if they've been exposed to a hazardous material, they need to be decontaminated by hazmat before you put them in your ambulance. You don't want to drag that into your ambulance. You don't want to drag that into the hospital. So make sure they've been decontaminated. Your secondary assessment, you're going to focus on the area of the body where they were exposed to the poison. If they inhaled it, you're going to focus your assessment on the nose, the mouth, and the lungs. If it was spilled on the skin, you're going to examine that part of the skin where the poisoning occurred. Things like that. Get a full set of baseline vitals. Continue to check those vitals every 5 minutes. If you see a change in level of consciousness or pulse or respiratory rate, blood pressure, skin, if anything changes, you need to take note of what time and what the change was. Reassessment, you're going to just keep focusing on those ABCs, keep them breathing, get them to the hospital, call poison control or call medical control to figure out what options you have for treating this particular exposure. If it was airborne, if it's something they breathed, we can dilute it with oxygen. If it was something that was spilled on their skin, we can rinse it with water. If it's dry, we'll brush it off first and then rinse with water. If it was wet, we'll just rinse with water. If it's something they ingested or they ate, we'll consider activated charcoal to adsorb to the medication so it can't absorb into the person's bloodstream. And treat them for shock, no matter which way they were exposed. Get as much information as you can to the hospital. The ER is not going to be in that person's living room or car or wherever you found them. They're not going to be able to see the bottles, the paraphernalia, all that stuff. So you have to get all that information to the hospital. They probably aren't going to get to talk to the bystanders. You're the one who's there asking all those questions. If it was something that happened at like a commercial place, usually they'll have a material data sheet for any kind of cleaning supplies or anything like that they use, and that needs to come with them to the hospital. That material data sheet will tell everything there is to know about that substance.